Welcome back. The South African Medical Association has welcomed President Cyril Ramaphosa's intervention in the effort to address widespread cases of suspected food poisoning. Among the interventions, the president has vowed to get hazardous pesticides off the streets and shop shelves, including spaza shops. Ramaphosa says the spaza shops contravening the law will be shut down. I am joined by South African Medical Association's chairperson, Dr Mvuyisi Mzukwa. Dr Mzukwa, thank you so much for joining us this evening. Yesterday, we heard from the president, some say better late than never. As the South African Medical Association, you have welcomed some of these interventions. Take us through what stood out for you.
Good evening to you and to your viewers. Thanks for inviting me to your program. We, like you said, the South African Medical Association really welcomes the intervention by the president. Though we think, the intervention is a little bit late. 22 children have already died, and this started early in September. There were reports all over of children in South Africa dying because of the poisoned food that they're getting in their local shops and vendors. But we also noted the interventions that he outlined during a speech last night. But to our disappointment is the fact that even though he makes a diagnosis, that the problem was that there's, this poison that is out there. It was acquired by communities because they wanted to get rid of rats. And rats came to communities because of the rubbish that is not well managed by municipalities. First of all, there's nobody who's taking responsibility of the 22 children that died. Is it because those children are the children of the poor? Secondly, the issue of municipalities. In the interventions, you don't hear the president talk about the refuse management or waste management in the municipalities, what they are going to do about it. You can go through the speech. There is nothing about, upping the game in terms of the municipalities. So these streets in South Africa will continue to attract rats because they are dirty streets, and municipalities are not held to account in terms of preventing people from, getting rid of the rats and accidentally killing the children.
And also speaking of that too, it does seem like, of course, a problem with local government as well, who has the responsibility of making sure that there's proper waste management too. He called on local government and saying municipalities must pull up their socks and they must make sure that there is waste removal. But if you're looking at areas like Alexandria, which are just infamous for the rat infestation there too, do you think enough was said about how local municipalities must make sure that they do that? And if they don't do that, then what the repercussions will be?
Exactly my point. When I'm saying, the president is telling about the causes of the problem, the root causes, but he does not come up with interventions. Because if you are saying municipalities are not capacitated in terms of human resource, inspectors are not enough, but in the intervention now, in the intervention plan, there is nothing that talks to that. How do you capacitate municipalities so that we make sure that the streets are clean, so that people don't find themselves fighting with rats and buying these pesticides that are dangerous to their own children. So you come up with this high-level kind of intervention, but you forget your basics. The president did not come up with the basics of intervening at the community level, because the problem is at the community level. These multidisciplinary teams and all this in South Africa are sleeping on duty. How can we have children dying when we have ministers roaming around on blue lights and the streets are dirty, as we can see, and you call this you want to protect the children. I don't think, we got that capacity to be doing that, in this country.
The president did, however, provide some direction, clear direction in terms of the interventions. They were pretty clear, the steps that need to be taken. I mean, also directing a joint operational and intelligence structures to be established, the task team as well, which also includes the NICD, the funding as well that will be coming from the DTI, the Department of Trade and Industry and Small Businesses, of 500 million rand. So there really does seem that there is a force to go into this crisis to try and deal with that. Do you not find that satisfactory?
You know that this is reactionary, but secondly, you know that there is a problem of poor implementation. We all know that. That, people will be flying money left and right, but there will be no implementation on the ground. This money will go, in most cases, it goes to corruption. So there are people who are already aligning themselves with that money. So the problem is, we need to prevent from dying. If we can't prevent, what's the duty of government? Duty of government is to protect its citizens, and they need to do that by preventing. They need to have all these things that the president was talking about in place. We shouldn't be talking about the intervention of intervention plans. When actually there are departments, there are ministers, there is local government. There's everybody that is supposed to be doing that. In fact, what we should be having now is we should be seeing the repercussions where the president is holding those that he deployed, to account for the death of 22 children in South Africa.
Another intervention that he mentioned in his speech as well, he was saying that all the deaths of the patients 12 years and below will be made notifiable in the notifiable medical condition and surveillance system. Now, what does that entail and what does that mean for the ordinary citizen hearing that?
Well, like I said, it's a good thing that, it will help government to monitor the situation, to see, where death is happening, and also to come up with further interventions. But the big thing is that we don't want to see children being notified as dead. We want them to live. I think we should be strong in terms of preventing children from dying. And that's a legislative responsibility that government has. I would, encourage, communities, to work with government on this one, and even to hold the government accountable. At times, if it means class action, in terms of the children that are dying because government is careless, I think the communities should do whatever it takes to protect their children if government can do that.
All right, Dr. Mvuyisi Mzukwa, thank you so much for sharing your insights with us this evening. Your line is a little bit bad, so I'm just going to let you go over there.